Welcome to the Total Human Protocol podcast. This is an opportunity that I take to sit with practitioners of all different types and healthcare providers and people that are into the stuff that I like to talk about. What we've done at our office is created something called the Total Human Protocol, which gives all these different options for services, hyperbaric and red light and Today, I've got Mitchell Buckmaster, who's been at our offices as a personal trainer, massage therapist for
It's going on 3 years.
I was going to say, we're going on that third one yet? We are, right? So going on 3 years. And if you've been around the clinic, at least at our chiropractic clinic at the Midtown location, he's been there doing the things. He runs the gym in the back. So you may have seen him back there exercising, training. He also does our massage therapy, which is by definition, it's massage therapy, right?
Hands on bodies.
That's it. Like you have the same degree as a massage therapist, but what we do is different. And so today, what we're going to discuss is I see patients every single day for spinal manipulations and adjustments. I correct the spine or the subluxation and allow the disc to free up. I allow the nerve to function like it's supposed to, and then it goes to the organ system and it goes to the muscle. But somebody, i.e., him, has to make sure that the muscle is functioning at its best and it has the right length so that it can move the body in the correct manner. And so that's where Mitchell is, and that's what he's successful at. Mitchell, tell me this. What got you into doing like personal training and massage therapy? Because there's not a lot. It's a hybrid gig for you, really, and not very many people are that.
Yeah, so I started training in 2014. At first, it was just kind of a fun side job trying to figure out the future. I was dealing with my own issues. I have a torn labrum in my right shoulder. I've got some issues in my right hip. From x-rays that we've done together, I found out I have 2 pars fractures in my back. I've rolled both my ankles probably 6 or 7 times a piece, and I wanted to play sports hard and I wanted to go hard and use my body hard, and I couldn't. I was getting slowed down. And after I started training, I realized that a lot of people were struggling to do certain exercises or certain movements. And it just didn't click for me that somebody could just be bad at raising their arm up. I didn't accept that. So I started doing a lot of foam rolling and corrective exercise, trying to teach people how to, have the same range of motion on both sides. And then I just felt as if there was still more information out there. So I turned to massage therapy school. And when I started putting hands on bodies and spending more time with the tissue, I started noticing people needed a moment of freedom, right? And that's kind of what the chiropractic does as well. It creates that opportunity for learning and for growth, right? And so when I started putting hands on people and getting their chest to relax or getting their shoulders to relax a little bit, they now had better range of motion. And I spent a lot of time thinking that you could, and this is before I met you, that you could outrun the joints by just manipulating the muscle. And what I've learned from coming to your practice is that not only do you need to create the space, but you need to learn the function. And you had to retrain your brain to actually work through that range of motion, So people who are shimmying their shoulders up to the first shoulder press, if I could clear out some of that debris and that junk, now they could flow through that motion. And then you just have to slowly increase the signal, make it louder, make them stronger.
So here's the facts. Ready? Here we go. Chiropractic adjustment. We manipulate the spine. Excuse me, 1 second. We're going to grab this. Cool. So we move the spine around and it does all kinds of fun stuff. And that's what I do as the chiropractor. We take an x-ray, we take measurements, and we look at what are the curves, 42, 40, 40. We want to know what does that articulate? And if they misalign, they put pressure on the nerves. If they misalign and put pressure on the nerves that go to your stomach, or at least the pyloric sphincter, the flap, T6 goes to the flap on top of your stomach, you may be having reflux or GERD, right? T6 also gives nerve supply to the lateral aspects of the muscles between the shoulder blades. And so I would adjust and take care of patients. And I've been doing that for 13 years. And when I met you, it had been a decade. And I was like, man, I'm getting close. I'm just not getting all the way there with the client because I don't have the time nor the knowledge base or the desire to sit and push and hold a tension point. And so what Mitchell does is he'll take and say, hey, okay, well, the low back controls all lower extremity, the glutes, the hamstrings, the quads, everything that happens down here. And if I get this to free up and it sends all the messages to the lower extremity like it's supposed to, somebody has to get the muscles to send a message back through the spine to go into here to make it all the way to the brain to make a functional movement. And I think that what he's talking about is that's where he was when we met. And then when we became together, as in how we treat patients, it's not I treat, you treat, he does the muscle, I do the bone.
There's a system.
We systematize what we're doing and why we're doing it. And then that's where people get the results. And so when he's talking about neurological deficits and they're shaking and that stuff, that's where I live. But I can get the nerve to go to the muscle. I can do that. Right. I've been successful at that without you. No offense.
Right. No, and it makes the perfect sense.
What I wasn't successful at was getting him to come into the clinic or somebody to come into the clinic and get them to fire the muscle to send the pathway the other way.
And for me, that's the long-term aspect, right? It's like somebody can, let's take a Navy SEAL, for instance, right? They're really good at being able to work through the pain or grit it and push, right? David Goggins, for instance.
Sure.
The guy's an animal. Is his body performing at 100% function? Probably not.
No.
He's got a lot of damage. He's got a lot of issues, right? And so when you look at somebody at the survival versus performance aspect, right? Like, do you want to survive and get through your life, or do you want to thrive and perform at a higher function and capacity? And so to me, it's worth investing the time, the energy, the focus on developing, symmetry, developing the balance, the coordination, the control. Because as we age, you see people, their bodies decline. Gravity is crushing us like a Coke can. And if you don't teach your muscles how to maintain frame, then you're going to have a neurological deficit. You're going to have impingements. You're going to have mechanical issues, and everything starts to break down over time. So when you can get in there and do some of the soft tissue work, the foam rolling, the stretching, and do it with the right intent, you can effectively change how a joint operates, right? So if somebody's shoulders are rounded forward, I don't just teach them how to pull their shoulders back. We have to create the space for that shoulder girdle to slide along the rib cage. And if you can do that and do that with, I guess like we're talking like the whole systematic approach, right? Then now they're learning a whole new behavior. They're knowing where to put their shoulders before they decide to reach up into the cupboard. You know what I mean?
I think it's also factual that I'll just give my story, right? Like when we met, I was a block, literally just a block, no cuts in my arms, none of that.
Super strong though. I'll give you that.
I was an ox, but I looked like an ox, right? Like big guy. And I wasn't that big. Yeah. But what he did for me was to understand that, and from an anatomy expert, from somebody that studied it, and I'm old enough to still do cadaver lab. They don't do that anymore. I used to have to skin people back in the day in school. Like I had to get in the cadaver lab. I studied those muscles, and until I really, a decade in, understood stripping out the muscle and identifying it and pulling it and making it separated, that's the sweet spot for somebody like me that was really just contracted. I move so much better. I'm a better adjuster. I'm faster with what I do at work.
I mean, if you look at body composition, you started to develop muscles a lot easier, right?
Yep.
The weight started moving faster and easier. You started to actually feel them and were able to flex them.
And if you told me that was going to happen from massage therapy, I'd have called you bull.
Yeah.
But I had no idea. I would just started to see the results and hold on, the lats are pulling out to that cobra pose, right, and that looks really good. Because
you start learning you learn new behaviors, new positions, and how to actually engage your muscles. And so, you can truly change the way your body is laid out. And if you talk from a bodybuilding perspective, like if you're lacking, strength or range of motion, or you're lacking just straight up control, then you're not going to get the best physique. You're not going to get the best spread. And so when we started doing our work together, it was really cool to watch because you had such a educated perspective on it that you were learning some of this stuff on the fly as far as how to operate your body. And so we were able to ping back and forth and learn so much.
Fast.
Yeah. And you were developing, you were cutting up quick,
Fast.
you know?
Because I was able to understand, okay, I know how to do the motion, I know how to do the movement, but I wasn't able to separate and isolate in specific and holds.
Yeah.
And I think that allows for the build.
And we weren't training 6 days a week.
No.
You know, 2 hours a piece. We were training full body, maybe 2 to 3 days a week.
I didn't have the availability for it.
Yeah.
And I think that's what people miss out on is like, if you can understand that you could leverage technology and leverage knowledge-based professionals. I like that. Knowledge-based professionals that are doing the things like, I mean, there's, I don't know how many in the state of Oklahoma, there's like 5,000 licensed chiropractors in the state of Oklahoma. And in the state of, I don't know how many massage therapists are.
Well, unfortunately, Oklahoma's regulated by the Board of Cosmetology here. And there's a lot of stuff going on that there's not a whole lot of oversight. So you can call yourself a massage therapist, but how you practice that varies wildly, you know?
I think that's how I describe it, right? When I'm like, you need to see Mitchell, it's massage therapy, but it's not. It's going to be tender. There's going to be some tough stuff, but it's going to work and you're going to do better. And one of the things that I think we need to lean in on is it's not a massage where you get oiled up and then you light a candle. I like those.
Not anymore. I actually do those pretty well, but I got so bored and tired in the dark rooms.
I mean, and you don't get
windows.
to talk to anybody all day either. That would be terrible.
Yeah, it's not great.
But what I know is that in those sessions where you see somebody that starts training doing squats, movement patterns, etc., then you're like, we can't do that today. We've got to get you on the table, do the soft tissue work. And I think that's the magic. That's the magic there is like, I see you where you are. Today, if we push you, because I'm a trainer and that's what I do, I'm here to train you. What I like about having you in the office is that you can intuitively see where the client is and say, it's not today. Today is not the day for this push. Let's get on the table and let's do soft tissue work because we have to loosen this before we can actually do that with effect. And so I think that's why we've had so much success with so many different variety of athletes doing all different types of things.
Because it's not, I mean, anybody can benefit from that, right? Anybody, I've treated people at 13 to 89. And so I've worked with people of all shapes and sizes, people with all, and since I've been to your clinic, so many people with different ailments, different issues, different things going on that they're just so unaware of their bodies. And so when we actually go hands-on and take that time, you know, in your quick adjustments, they do get freedom, but they don't connect with it near as well. And so when I'm actually able to sit and put, you know, 2, 3, 4 minutes, 5 minutes on one area and create all this blood flow and space, they almost get another sense about their body and they're able to connect with that and move through those things better.
I think it becomes treatment times for tissues, right?
Right.
So like when I'm going through a spine, I'm going to blow through the spine. I'm going to get the segment to move, unlock it, allow the nervous system to work. And I believe factually and actually that the nervous system is going to work better. And whatever it's going to is absolutely going to have more nerve supply, just like the light here. It's going to light up bigger because it's got more electricity. But what the heck if that light, if we took the shade off, i.e. you moved the tissue, you allowed the fascia to move, now the light's even brighter.
Right.
And that's where that togetherness becomes something, because it's like, okay, Matt can create, Dr. Matt, whatever you want to call me, like you can create the motion through the spine and it can have intersegmental motion. What is intersegmental motion? That means every vertebrae moves. But if I can get every vertebrae to move and you don't do anything with the said motion or movement, now we've lost everything we've gained. And I think that's the win with what we do, is that allowing, hey, we can create the intersegmental motion, which will allow your nerves to function, which will allow the muscles to get what they're supposed to get. But if they're not in the right length or pattern, it's not going to work.
So to me, muscles, and they actually are pumps, and they are also pulleys, right? And if we can get the muscle to pump and squeeze and contract and relax, we get blood flow. We increase the push of fluid, right? And then the second aspect is if I can dampen the signal on one area, I can increase the intensity of another, and reciprocal inhibition, right? So you get, you know, bicep flexes, tricep stretches, and opposite, right? If you are overly tight in your tricep, you're not going to contract through your bicep near as well. So what we do is we go in and inhibit the bicep or the tricep a little bit and increase the bicep immediately. And then from there, it's just repeatability. How often can you do that? And now your brain says, oh, okay, that's a range of motion that I need to remember because he's putting me under stress every Tuesday, Thursday with this same range of motion.
And it's also why we see so many bodybuilders and people that are in physique in the office, because they're like, hey, I can't get my bicep to grow, and I do them every day. Oh, my calves won't do the thing. Oh, my quads won't do the thing. And it's like, well, you can train them till you're blue in the face, but it doesn't matter if we're not getting nerve supply and the muscle to work like it's supposed to, so it can fill and do the thing it's supposed to do.
Because if you go and just hit quads every day, right, and you just stress them out, the muscles will actually start to bind to each other. So instead of having 4 quads working to do a slightly different pull, now they're starting to tie in. The electrical signal says, okay, fire it all at once. And you see this in a lot of bodybuilders because they spend so much time just beating down on the muscle versus thinking about the range of motion, thinking about the movement. And so to me, that starts to inhibit and create more unwanted stress on that joint or on that muscle, and it all balls up. So instead of having, cut quads, you have one big loud quad.
I remember it.
We had to strip his quads. It was rough.
I remember it well, and it's not comfortable to receive that kind of treatment. However, very effective, very effective. And I think that for those people that have mobility issues and they're in a stuck position where, and I say stuck position where they're still exercising, but they know they have given mobility issues, and you're not seeking a corrective soft tissue specialist, you're missing the boat.
For sure.
And it's like, it's low entry fee, it's easy to take care of. And the truth is they're 30-minute sessions on average. So they're not these long drawn out sessions that take a long time, because it's focused on the thing you're trying to get accomplished so that you can grow to that place. If you're going to get, we don't do it. We don't light candles and we don't do the oils and all that stuff, because that's not what we're trying to do there. There are spas that are amazing in Tulsa, and I can get those people for you. But what he does is functional movement. You want to see how it moves, you want to see how it's going to work, and how is it going to move into the future. And I think that's the beauty of it. But it comes from a knowledge base and intuition. And I would be remiss if I didn't say, you can get somebody that's educated in both of these fields and you can use them all the time, but you have to have a practitioner that is intuitive, and that's what he has. And I'm not telling you that because it's something that I see. It's something that your clients see. It's something that people come to me behind your back to say. They're like, he knew what I needed that day, and he didn't even know that I needed, it wasn't his plan. He had a workout written.
It was tough for me for a while because I was wearing 2 different hats versus wearing them together. And I would be frustrated because a client would need to get through a workout, but they were physically struggling, or they would come in exhausted and not have the capacity to be able to go through the workout. So I started molding my practice into an all-inclusive, which, some people who pay for training they want to get their butts kicked and they want to just go through it. But I'm looking at the long term, right? I'm looking at it from a perspective is I've got to train you again on Tuesday, but I need you to move well all weekend. So how do I, meet you in the middle and do what you need, but also give you what you want? And that's a hard one. There's some clients who are stuck in their head about what they want and what they need. But that, like you said, is our job to, I think, take that responsibility on and kind of look at it from a long-term perspective. How do I keep you moving in the right direction? And what I get frustrated about the fitness industry is it's all about how tenacious you are, how aggressive you are, how much you beat up on your body. This thing's I got one life.
Yeah, man.
I got to make this
machine
thing,
you ever own.
Right. And you can fine tune it to be incredible, but you got to take the time to put in some work and some effort. And if you look at mobility as like its own little thing and training as its own little thing, you're missing the mark. And if you train with the intent to improve function, improve strength, and not just muscular, right? We have energy systems that are a big demand, right? And if we can synchronize all that, now you're operating like a machine. And that's why we have high-level athletes. It's not that they were born with the mindset. And I think that's what really gets a lot of people, right? The physical body is the same. We just need to go in and fine tune it. Some people come out a little bit better understanding than others. And so we have to go in and clean up all the debris and clear out the spinal issues and clear out those mechanical issues, and then synchronize.
Yeah,
And if
you got to get
that,
all the pulleys and all the
Yeah.
cables to start to work so that the machine starts to turn over. So in the break, we were talking about some of the fun stuff that we see, and we see it reoccurring all the time. What we currently are seeing a lot of is clients that are coming in looking for, hey, I'm going to have a knee replacement, or I think my knee is going to be replaced, or that inside of my knee. And honestly, about 80% of the time, the medial aspect or the inside of the knee is the first side to wear out. And what we see in the office is a mechanism of injury that's reoccurring in that 50 to 57, 60 range, sometimes up to 65 range. And at that point, it has worn out. So if you're catching this as a piece of just gold that we wanted to give you, we're going to give you a little piece of clinical advice that he wasn't expecting to do, and neither was the team here, but we're going to make it work because I know for a fact somebody's going to catch this and start to do something about it.
That's a Dr. Matt thing, by the way, off the cuff.
Sorry, but it's gold, and I want this for you because we help so many people with it, and if they just catch the content, then
It's a simple thing.
it's a simple thing to fix, and you don't have to have the replacement. Okay, so what happens with the knee? Tell me why do we get so many knee issues? I know the answer, but this is more fun if you answer it.
Well, what I find is that most people, because of our daily jobs, sitting, a lot of sitting, it effectively turns off the neuromuscular, right? So when you sit for an extended period of time, your nerves to your hips start to basically shut down, turn off. And when you go to stand, our quads are usually, we're still moving our legs, so our quads are pretty dominant. So they start to drive down.
That's the front of your legs.
Right? And when the quads go down, the hips roll forward, the adductors tend to take over. Adductor magnus specifically starts to take over for hip extension, right? So when somebody's going into a squat, we start to bow in on the knees, and then we're standing up, leaving our hips behind us. And so what I find to be the most agitated tissue is usually high up in the inner thigh, the adductors, and right here, medial side of the knee, because that femur is rotating in.
Why would the femur rotate in? What muscle's weak?
Because the glute medius is not strong.
That's what I wanted.
Glute medius and piriformis are the go-tos. Everybody tries to release the piriformis because they usually get hip tension, hip pain, but ultimately what they need is more strength to those. So that way, when they squat, they can keep the femur rotated out just a little bit, and they'll start to sit back in their hips and are able to drive from their glute maximus.
So one of my favorite things to do in the clinic is we'll have somebody stand and do a squat, or we'll have them close and stand on one leg. Could you do that for me? Could you just, just do a single leg. There we go. So typically what we'll see is he's starting to try to do it a little. We'll start to see that he begins to rotate that femur and it starts to go in. If he engages his glute on the outside, boom, he locks in the hip. What happens is, what I want you to understand is, you can step out of it, is when he's going through a walking motion, or when you're going through a walking motion and you're not getting the glute medius to work, it's making the knee go at this angle, at that sharp angle. Over 20 years, it wears out the meniscus and it just grinds on that. And guess all you had to do? You had to strengthen up one butt cheek muscle to actually pull the knee back to avoid the knee surgery. And so I know that I was going off on the tangent, but I want somebody to catch that, because had you known that there was a glute activation technique, which we don't have to show them here, but come to the office, we'll show it to you there. Had you known that there was a glute activation technique, a way for you to train a muscle, specifically one muscle, not all of them, the one muscle, to be strong enough, it would actually pull the knee back in and have it line up like it's supposed to so it doesn't wear out. Now, if you're my age and you're in your 30s and your 40s, or you're 41, learning that now is going to keep me from having to have a knee replacement later. And so that's the gold I wanted to give him. It's like, yeah, we do a lot of cool stuff, but even just that one little thing is a piece of a whole myriad of things that could be creating your issue. And guess what? Anybody think that it was the knee that was causing all the problem?
Right. The body's super organized, right? And so when you see somebody with a dysfunction, we see somebody with a dysfunction, it's a lack of control, right? They don't understand how those pieces are connecting and how they should be operating. So what we do is we go back in there and give you the freedom of space and range of motion, and then we download that new information. How do I walk without my knees caving in? Or how do I walk and actually get the feel out of my hips versus my knees and my feet? And so that's kind of what our goal here is to help you learn those things so that we can keep the body moving well as long as you want to.
So much bigger than just being an Olympic athlete, being a golfer or a runner or the guy that's doing all the things. What we're doing in the clinic is for you because you're human, right? And that's what, like, total human protocol, it all rolls into that. That's why we call it that, because it's not just a chiropractic clinic. It's not an IV clinic. It's not a hyperbaric clinic. It's not a Pilates studio or a gym. Yes, it's all of those things. And that is what total human protocol is. What's your protocol is a tagline we use because you have one, and it's not going to be the same. His workout for me is not the same workout it is for Sally, the 82-year-old lady that comes in. Like, I hope at least he's not giving me that same workout, right? And so I think that it's important to note that what we've done with Total Human Protocol and the vision that we've created as a team is that we're leaning into the fact that you've put a bunch of different healthcare providers in the same space, do it with the same mindset, looking for the things to solve the problems for the clients. Now we're winning for you and for them. And we see it every day. And so it's difficult to get every person in here in front of the camera to talk about those things, but I just wanted you to have that little piece of gold. If you're my age group, that's going to keep you from having a knee surgery later. I could promise you that.
It's funny because I've had a vision ever since I started this career that I would love if somebody came in and instead of bouncing around to see 10 different practitioners or all these different people to handle an issue, you have a team of people looking at the same problem, the same system, the same you, and creating a plan. And that's what we've done. And it wasn't even by intention. Like, we started off just, hey, I've got a gym space. I need people back there working out and using it. And I was like, okay. And as we've gone through our past 3 years, it's like, it's developed into this total human protocol. How do we take somebody from no matter where they're at and get them to perform better? And now we have not only the practitioners, but we have the tools to get down to that at a cellular level and really work towards change. And I think it's just such a fun thing to be a part of. And I don't know of any other places that are doing this.
There's a lot of toys. We have a lot of fun toys. There's a lot of things that if you're looking for performance and you're looking, what are you looking for? We can do it. We've done it, or we're doing it well. But I will tell you this, it's all natural. So if you're looking for something that's not all natural, that's probably not us. If you're looking to do something that's going to be super easy, we're going to ask you to do a little bit of work. We're going to ask you to take ownership of your own self and of your own body. And I don't want to pull any punches about that. That's exactly what we do. Like, when you work on me, that is not awesome. The results are awesome, but it hurts a little. It's sore. And when I adjust, some people don't love that. And when Michelle makes you do that crazy Pilates move, that's not fun. But being a total human means that you got to go do the things that are going to get you better moving into the future. And I think that's what we're doing here. So I appreciate you coming on. I hope that you guys check him out. He's who I go to. And so you can't have my slots, but he does have slots available, and you can check him out. Total Human Protocol, 918 Chiropractic, 918 Fitness. He's all over the place. We do a lot of things together. Thanks, Mitchell, for being a part of this.
Yeah, brother. Thank you.
You got it.